Hi there, let's talk about the symptoms of uterine fibroids. Uterine fibroids, also known as leiomyomas or myomas, are non-cancerous growths that develop in or around the uterus. They are composed of muscle and fibrous tissue and can vary greatly in size, number, and location. While many women with fibroids may not experience any symptoms, others may face a range of physical and emotional challenges depending on the size, number, and position of the fibroids. 1. Heavy menstrual bleeding. One of the most common symptoms of fibroids is menorrhagia, or heavy menstrual bleeding. Women may experience prolonged periods, passing of blood clots, or the need to change sanitary protection frequently. This excessive bleeding can lead to anemia, which in turn causes fatigue, dizziness, and weakness. 2. Pelvic pain and pressure. Fibroids, especially large ones, can cause a feeling of pressure or fullness in the lower abdomen. Some women describe this as a bloated or heavy sensation. In cases where fibroids press against nearby organs, it can lead to pelvic pain or discomfort, particularly during physical activity or sexual intercourse. 3. Frequent urination. Fibroids that grow on the front side of the uterus may press against the bladder, causing increased urinary frequency or urgency. Some women find themselves needing to urinate more often, or feeling as if they cannot fully empty their bladder. 4. Constipation and bowel issues. When fibroids press against the rectum, they may lead to constipation, difficulty passing stools, or a constant feeling of needing to go. This is more common with larger fibroids that grow toward the back of the uterus. 5. Lower back pain. Some fibroids, particularly those located on the outer back part of the uterus, subserosal fibroids, may press on spinal nerves, resulting in lower back pain. 6. Pain during intercourse. Known medically as dyspareunia. This symptom can occur when fibroids are located near the cervix or in positions where they are compressed during sexual activity. This can lead to discomfort, pain, and emotional distress. 7. Reproductive challenges. Fibroids may affect fertility in some women. They can interfere with the implantation, block the fallopian tubes, or distort the shape of the uterus. Some women with fibroids experience difficulty conceiving, recurrent miscarriages, or complications during pregnancy such as premature labor or breech birth. 8. Abdominal enlargement. Large or multiple fibroids can cause the abdomen to become visibly enlarged, sometimes giving the appearance of pregnancy. This may lead to body image concerns and emotional distress. Now, let's talk about the treatment options for uterine fibroids. For mild cases, doctors may recommend watchful waiting, just regular checkups to monitor the fibroids, especially if they're small and not causing problems. Next are medications. Hormonal treatments like birth control pills or injections can help control heavy bleeding. A special device called a hormone-releasing iod can also reduce bleeding. There are also medications like tranexamic acid and pain relievers to manage specific symptoms. If symptoms are more severe, minimally invasive procedures may help. One is uterine artery embolization, which blocks blood flow to the fibroids, making them shrink. Another is focused ultrasound, using sound waves to destroy fibroid tissue. No cuts, no surgery. For women who want to preserve fertility, surgical removal of the fibroids, also known as myomectomy, is often a great choice. And for those who are done with childbearing and want a permanent solution, removal of the uterus, also known as hysterectomy, may be recommended. Some women very close to menopause might be advised to wait it out, especially if the symptoms are minimal, as fibroid stops growing and shrinks during menopause. This is majorly due to withdrawal of estrogen. Bleeding also stops as menstruation ends. Finally, some women explore newer treatments or lifestyle changes, but always talk to your doctor before starting anything new. With the right approach, fibroids can be managed effectively, and you can feel like yourself again. Conclusion: fibroids are a common yet often misunderstood condition, affecting many women during their reproductive years. While some remain asymptomatic, others experience significant discomfort that can affect daily life and emotional well-being. Recognizing the symptoms of fibroids is essential for early diagnosis and appropriate management. Women experiencing any of these symptoms should consult a healthcare provider for evaluation and to explore treatment options tailored to their specific needs. Thanks for listening.